Hello and welcome to We Poets. My name is Sally Baker and I'm the host of We Poets. We Poets is a poetry show for boys and girls between the ages of 6 and 13 years old. So if you would like to be on We Poets and read your poetry, please have your school teacher or your parents call me and you too can be on We Poets. Today we don't have any We Poets, but I have a very special guest who's a doctor, and his name is Daoud, am I pronouncing that right? Daoud Lankford. And he's a urologist, and he practices in Oakland, California. And he has written a poem, and I have written a poem. So even though we don't have any children on the show today, we are going to have some poetry. So without further ado, I would like to introduce you to Dr. Lankford. Hi, Dr. Lankford.
Hello, Sally. Thank you for having me.
I'm so glad that you could come and tell us all about your interesting career as a doctor. So tell us, what is a urologist?
A urologist is the specific doctor that focuses on the genitals and the urinary system. So we're basically scientists of urine.
Somebody's got to do it.
That's right. Somebody's got to do it. And it's very fun, too.
Oh, really?
Oh, yeah. I love it.
How long have you been a urologist?
Well, Sally, I trained in urology for literally about 12 years.
Wow.
So I finished my training in 2015.
Mm-hmm.
So I've been a practicing board certified urologist since around 2015.
Mm-hmm.
But I've been practicing and doing what I do for over 12, 15 years.
Good. So could you tell us about your background, how you first started out, and what colleges you've attended, please?
Sure. You know, where I began in this healthcare journey, on Saturdays, I got $10 to get my hair cut.
Oh.
And I would go to Johnson's Barbershop on Sacramento in Berkeley, California. Mm-hmm. And my barber, her name was Mrs. Johnson. People called her Pumpkin.
Pumpkin.
And so what I would do is, I would sit in the barbershop for hours waiting for my turn for a haircut. And anybody who has to get their haircut at a African-American barbershop, you know what I'm talking about. So I would wait for hours and people would talk about their health concerns. You know, you had people selling things for health tonics, and they would talk about their high blood pressure, the diabetes. And so that kind of sparked my interest into healthcare. I ended up graduating from high school, attending the University of California at Berkeley. And at Berkeley, I was a molecular and cellular biology major. I was interested in medicine. But I also ran track, and my first love was actually acting and poetry.
Oh, good.
So that's why I'm really excited to be on your program, because I was one of those wee poets. I was doing poetry since the ages of 6, 9, 6, that age bracket. So when I got to Berkeley, I was doing a lot of the arts, but medicine and science was always an interest of mine, because of those discussions I had in the barbershop as a youth. And that led me to end up going to medical school at Meharry Medical College in Nashville, Tennessee, which is an historically Black university. And I got an amazing education there. I met so many other healthcare practitioners that I'm close with to this day. And from there, that's a 4-year escapade in medical school. And then after that, I did my internship at the University of Southern California. I ended up doing a fellowship in urologic oncology, which is specifically cancers of the genital urinary system, at the National Institute of Health, at the National Cancer Institute, NCI. And then I did my residency in New York, at New York Medical College. I also did a fellowship in robotic surgery as well.
What is robotic surgery?
What's that?
Robotic surgery, you said?
Yeah.
What is that?
So robotic surgery is the use of a robot, which is an actual robot, to do surgery. It's kind of the most common surgery that's done in the genital urinary system. We use a lot of robotics to dissect and things without having to touch the body.
Oh.
So it's an actual instrument that gets inserted into the abdomen, and it does the dissection for us.
Oh.
With air in the abdomen. Yeah, it's pretty cool.
Wow.
And so that's one of the reasons I do love urology, is because of the technology that we use. We're able to use some great technology, and you're able to sort of, push the envelope, do things that are new. Yeah, that's what I love about urology.
Wow. Well, I'm sure things have really changed since you went to college there and were working at the various hospitals.
Yeah.
The updated thing. Can you tell us a little about the new changes that you've learned?
Well, I think that healthcare and medicine and technology is always changing. We're here in the Bay Area, and that's one of the beauties of living in the Bay Area. It's sort of at the cusp of technology and innovation. All of these things sort of have been developed and created here in the Bay Area. So that's one of the things I am sort of always sort of trying to catch the pulse is of the new technology. And so everything has changed, but essentially once I started training, these things were kind of new.
Mm.
And so I was able to learn them, as being one of the first pioneers, one of the first people in learning these techniques.
Good.
That are now essentially standard.
Oh.
So it's good because we have experience. We have experience doing what the old guys used to do.
Yes.
And then we know what the new people are doing.
Right.
new kids are doing.
Right. Well, do you find there are more men in this field than women? Or
no, that's an interesting question, Sally. I think that in medicine in general, it was always sort of dominated by men historically.
Mm-hmm.
But more recently, over the past 30 years or so, I think women have high numbers, and there's statistically higher women that are becoming doctors than men when you compare it to men. I don't know the exact statistics, but I do know that Black men in general are the lowest numbers of admitted medical students, and this is a big issue because of the disparity in Black men in medicine. There's been a number of initiatives to try to help enhance the opportunities for Black men to get into medicine. And also, once Black men get into medicine, there's been a number of initiatives to help keep them in medicine, because we know that having a healthcare force that's diverse is important, because we have a very diverse country, and it's always good to have every tool at our disposal to be able to help people, be able to relate with people. And so I think that that's one of the initiatives now is to help increase Black men. But I do think that there is a disparity of women in urology. I was honored enough to be able to be mentored by a lot of women in urology. In fact, some of my chief residents were women, and they really treated me like a little brother and helped me along my way.
Yes.
So it was good.
You were like their little kid, their little brother, maybe?
Little brother.
Yes. Well, I do have one African-American doctor, a woman, and I'm very pleased with her. She's a dermatologist, and so I go to see her. But I do think that we need more African-American doctors, especially like you see men, I think.
Yes.
Because when you go in, if you don't see anybody that's like you, when you're going in to be treated, it's sort of hard sometimes,
Mm-hmm, mm-hmm. Yeah, that area is very important in medicine, where we talk about how when you go and visit your doctor and you go and have a healthcare experience, what do you take from that? And that's kind of critical, because there's a lot of people who go and visit their doctors and they don't know what happened. They don't know what their sickness is. They don't know what medications they were given, and it's sort of a blur. And so now we're trying to figure out, how do we give patients or give people the tools to be able to go into these visits with their doctors and obtain the information that they need. Mm-hmm. And so that's what's important. Sometimes it has to do with culture. It has to do with language barriers and all of these things. And so we as physicians, or we as doctors, we have to understand how to talk to people. And that's why it's important for me to talk to the younger age group, because they're the future. And as they go into medicine, it's important for them to understand that sort of the whole experience, when the patient or someone who's coming into your office, it has to be centered around them. Mm-hmm. Are they understanding what we're talking about? are they able to institute all of the different interventions that we've discussed? Are they able to take action on our suggestions and things of that nature? So
now, do you see many children, or your patients are all adults?
My patients, I did train with pediatrics and pediatric urology, so I did see children during my training. But in my practice, my private practice, it's all adults. I do, however, see some adolescents from 16 to 18. Because 16 to 18-year-olds generally present with a lot of the issues that adults present with on some level. But they're still, so I do see them. But I always have their parents, legal guardians,
with them,
yes, and share, and they share in the decision-making process for the care.
Now let's see here. Let's talk about what is health urine.
Healthy, yeah. So healthy urine is important. One of the things I like to talk about with people about urology and health is the fact that sometimes we talk about drinking water, and that's important for your body. And that's important for your urine. If you see that your urine is dark and it's really yellow, real deep yellow, maybe that's an unhealthy urine. So I think it's important for kids and everyone to know that your urine should be light. And so that's a healthy urine. A healthy urine is light urine. A non-healthy urine is dark urine. Yeah.
So they should be drinking more water?
Yeah. So if you see that if you know that you're supposed to have a lighter urine and your urine's really concentrated and really dark, then that means you maybe should drink more water. And I would say 6 to 8 glasses of water a day will keep the urologist away. So you should drink as much water as possible. 6 to 8 glasses is important, even when you're a kid. Drink much water.
And let's see here. Why do we leak urine when we laugh?
So this is an important factor. Some of the kids may be somewhere with their mother, and their mother maybe laughs and they leak urine. That happens a lot of times because our pelvic floor and our muscles in the pelvis aren't educated. And that happens when you're a kid too, is that you should be understanding how squatting and not sitting in the chair all the time is good for you. Because when you sit in the chair, sometimes it cuts off the muscles in your pelvis. And if the muscles in your pelvis are really weak, then you do things like leak when you laugh, or you just have a general pelvic unhealthiness, meaning that you're not, your back pain, you have lower back pain, you have issues because of your pelvis is not strong, it's not educated. So that is one reason why you may leak when you laugh. Also, a lot of women, when they have babies, the babies that come through the canal, they can make the pelvic floor a little weak. And so when it gets a little weak, they may leak when they laugh. So that's why it's another reason for women and men to have an educated pelvis where they, do pelvic stretching, pelvic floor exercise, not just your arms and your chest and your legs, but also your pelvis, which means you're getting into squatting maneuvers where you're squatting down. And that's our natural way of sitting. As I think that chairs have sort of an easy way out from sitting. Having to squat and having to sit with your legs crossed is all good ways to educate your pelvis, to get it stronger so that it prevents you from leaking when you laugh, and things like that.
So it's better to cross our legs rather than to sit with them open?
Well, I was sort of, when you're sitting on the floor, right, and you sit cross-legged on the floor, that is a way where people can sit, and if you ever try it, sit on the floor cross-legged, and try to sit straight up. It's kind of hard.
Nice and erect, huh?
Nice and erect. That is an educated pelvis. Not when you're sitting. When you're sitting in a chair, it doesn't matter if you're crossed or uncrossed, because you're sitting in the chair. The chair is doing a lot of the work for you.
I see.
But when you're sitting cross-legged on the floor, you're very, it's tougher. It's your stomach, your abs are working there. I would get down and sit down for you right now, but I would throw off the
no,
camera.
That's all right.
Give a demonstration.
Now, since we were talking about leaking urine when we laugh, I wrote a poem about one of my poets that I had many years ago. He was a little boy, about 8 years old. And I wrote this poem. He was so cute. We were sitting in the chair, and he would whisper to me, Miss Baker, I got pee. And I ignored him. We kept on doing the show. Second time he said, Miss Baker, I got to pee. I still ignored him. He finally got up at the chair, out of the chair and walked off the stage and went to the bathroom. He said, I'll show her. So I wrote this poem.
Oh, great.
I wrote this back in 1983.
Wow.
And it's titled, I Gotta Pee. Mama, I gotta pee. Hush, child, stop pulling on me. But Mama, I really gotta pee. And I said, stop pulling on me. Won't somebody please tell me, little old me, don't grown-up folks ever gotta pee? And he was so cute. He came back and we finished the interview.
Oh, well, at least he didn't pee on himself.
Yeah, that's true.
That's important. That was good.
Now, let's see here. My next question. How do exercises increase your muscles?
Well, I think that's a major part of urology is men's health and muscle mass and improving your muscle mass. So I think the exercising is a way that you increase muscle mass and you increase your testosterone levels. And so the main goal really is to educate people, educate men and women about exercise. Exercise as much as possible. Move your body. Moving your body and exercising helps you prevent disease. And so some of the diseases, high blood pressure, diabetes, also osteoarthritis, all of these things are benefited or helped or prevented or treated with exercise.
Mm-hmm. Mm-hmm. Do you ever go into the school classrooms and give presentations to the children?
Unfortunately, I haven't had the opportunity, but if anyone would like to invite me to come into the classroom and give a presentation, I feel happy to do that.
Mm-hmm. How about nursing homes? Have you ever gone to nursing homes?
I have gone to nursing homes, but that is to see my patients.
Yes.
But I think nursing homes are a great place to talk about some of these exercise because this, if we, when we're young, it's pretty easy to exercise. You have recess, you play. But as we get older, we don't have those built-in times to go exercise and play because we have to work. So I think that grown-ups still need recess. We still need time to go and exercise.
Mm-hmm.
Yeah.
What do you do to exercise?
So I love running. I run at least once or twice a week. And then every day I do something for my body, which involves stretching, push-ups, sit-ups, things of that nature. Main thing for me is stretching at this state because I've done so much exercise in my life with running, track and field and things of that nature that now it's all about keeping all my body balanced. So that's my main focus is balancing my body, stretching every day, push-ups and sit-ups, improving my muscle mass to help testosterone levels. That's pretty much what I do every day.
Good. Now, you did tell me you write poetry, right?
I do write poetry.
So why don't you be my poet also, in addition to my guest?
Sure.
Okay,
sure.
Let's hear what you've written, please.
So, this was an old poem about love. And one of my patients actually is a novelist, and he writes about love. And I asked him, well, why do you write about love? And he told me love has motivated his life. He basically said that everything he's benefited from or received in life has been due to love. People having love for him, and people doing things for him, and him doing things for people. And having love for people. Good. So with love in mind, I'll give you this poem. It starts off with burning eyelashes. She cries for the lost love that's heaven sent, rejecting what was provided in present tense. She's sleepwalking away the pain, and I'm watching her dream. She likes optimism, but a certain prism disrupts her vision in the unseen. And she follows no one as she did before. It's hard to lead when you can't use all four. Wake up. That is youth stuck, intoxicated by the celebrations of this world rolling dice. Enticing iced teas we sip on settings under the sun, avoiding the only thing that really would make us one.
Good, very good.
Thank you.
Did your friend have that published?
No.
Oh, okay. Okay.
Maybe we should think about that.
Yes, yes. You should have, maybe you could have a little poetry corner in your office and people could write down little poems.
That would be that.
Yes. And you could have a bulletin board there and put the poems up, poem of the week. Or, you know.
That'd be
a great idea.
Definitely.
Now, let's see. Now, let's talk about COVID-19. What we should be telling our children about COVID-19 in addition, to washing your hands and what have you.
Yeah, no, definitely. So I think that, first of all, COVID-19, every county has a public health website. Alameda County has Alameda County Public Health, and so on. Berkeley is also Alameda County. Berkeley has its own health infrastructure as well, and CDC. So I would definitely recommend everyone view those guidelines, especially the mask guidelines as they change, depending on the statistics, how many people are being infected and what's the hospitalization rate as we have this virus that changes. But I think that it's important, and we all sort of have been re-educated about washing our hands after, you touch someone, after you shake someone's hand, after you have a play out there in recess for the kids, washing their hands and not touching someone and then maybe scratching their eyes or touching their nose, or because those sort of transmissions of if someone else has an infection, it's easy to transmit it via touching your hands, touching your nose, or in this situation, it's important to always be mindful of what the statistics are. If there's an upsurge in infection rates, which I believe in Alameda County right now, there's an upsurge in infection rates, then that's an important time to look at the mask mandates. Is it a time for you to start wearing your mask? There was a time when the mask mandate was dropped and no one was wearing their mask. That has changed now in Alameda County. Now there is an indoors mask mandate. But that during these times of surges, it's important to be extra vigilant for the children and for the adults, because you know that there's more people infected during these times. So you should, make sure you're washing your hands, make sure that you're wearing your mask, and make sure that you're not, being around people that you may not know what their status is, okay? Because maybe during surges is the time to stay a little bit less, you become a little more sequestered and a little bit less free, for that time. I think that's a good idea. But most importantly, you gotta, live your life and enjoy life and and try to do what you can to prevent your infection during this time.
Mm-hmm. Now, do you think the homemade masks are better than the ones that we're wearing?
Well, there was a number of studies that was done in the beginning of the pandemic that looked at the surgical mask versus just a t-shirt mask. And, of course, there was findings that the surgical masks were better than using a t-shirt, or even an N95 mask is better. But I think that the goal is to protect yourself and protect others. And so anything you use can be a beneficial for your, anything you use, I think will be good to prevent infection. But if you can get a hold of a regular mask, a surgical mask, that would be fine. But I think all of them are equivalent in just limiting the amount of respiratory droplets that you give out from your mouth into the environment. Mm-hmm.
Now, could we briefly talk about the telemed, where you don't go into the doctor's office, you do it on the TV screen?
Yeah, telemedicine is great. It's a new, well, not necessarily new, it's always been around, but it's very popular these days, where if you're not feeling good, if you're feeling kind of under the weather, you can get on a video conference call, which is compliant with the governmental regulations for healthcare. And you can talk to your doctor over the video screen. You can show, if you have something to show in terms of a physical exam, you can show that, and we can discuss, order medications, and monitor people via video. And I really like it because it helps people stay at home. It helps protect people from transmission of the virus if that's an issue. And it also gives people a little bit more time instead of being in their car and waiting in a waiting room and disrupting their day. It's very beneficial for the patient and the doctor.
But I like that. I like to come in and see you in person. I don't like to talk to you on the screen.
Sure. And that's still there, in person. And there's some things you can't do over a screen. You got to do.
You got to do in person.
Yeah, and it's great. But there's some situations where people, they may be sick and they want to do it over the video. So that's.
Well, I think our time is just about out, but I want to thank you so much for coming and letting me interview you and getting all this good information out about urology, especially because many people maybe don't know what a urologist is,
Yeah.
And that's been around a long time, right?
Oh, urology has been around a long time, since the way back when, during the First World War and all those, where medicine is one of these things that it has evolved into the specialists, and but urology is very important because prostate cancer is a disease that affects many people. It's very common. Odds are someone at home has been affected by prostate cancer, or someone they're related to has been affected by prostate cancer, and so the urologist is sort of critical in that disease, but also men's health as well, and protecting men's health and women's health. We talked about leakage, and frequent urinary tract infections is another issue that a lot of women face, and the urologist helps women with those issues, but definitely with men as they get older, the ability to urinate, the ease of urination is a factor as well. And so we really help with those issues, and I think everyone has to have a urologist.
Yes, very important. Well, again, I want to thank you for coming, and you've given us so much good information. And boys and girls, if you would like to be on the TV show like Dr. Lankford has been, or if you're an adult and you would like to come in and talk about your career and your profession like Dr. Lankford has, please call me at the number that will appear on the screen, and I'd love to have you come and share your good wealth of information. So without further ado, shall we wave goodbye to our watching audience?
Yes.
Goodbye, everybody, and thank you for watching.
Bye-bye.